Burns are classified based on their type and depth. Types include scald burns, often from hot liquids, and flame burns, caused by flammable materials like gasoline or kerosene. Other burn types are chemical burns, common in industries, electrical burns, which can stop the heart and are worse than other types, and radiation burns from sources like X-rays or nuclear explosions. Burn depth assessment starts with the patient's history. The severity of skin damage is both temperature and time dependent. For example, hot water at 65 degrees Celsius can cause a superficial partial thickness burn in 7 seconds and a full thickness burn in 45 seconds. This slide is a visual representation related to burn depth, though no text description is provided. Burns are classified by depth into first, second, third, and fourth degree burns. These classifications range from superficial to full thickness burns. First degree burns, or superficial burns, involve only the epidermis. They are characterized by redness and mild to moderate pain, such as a sunburn. Healing typically occurs within 3 to 6 days. This slide provides a visual example of a first degree burn. Second degree burns, also called partial thickness burns, involve the epidermis and parts of the dermis. They are subclassified into superficial partial thickness and deep partial thickness burns. Superficial partial thickness burns extend only to the papillary dermis. They feature erythema, blistering, severe pain, and intact pinprick sensation. They heal in about 2 weeks without scarring and don't require surgery. Deep partial thickness burns damage the deeper reticular dermis. The exposed dermis is less moist, and the injury may involve sweat glands or hair follicles. These burns are painful, waxy, and less elastic, with reduced blanching to pressure. In deep dermal burns, color does not blanch, and sensation is reduced, making it hard to distinguish sharp from blunt pressure. Without surgery, they take 3 or more weeks to heal, often resulting in hypertrophic scarring. This slide displays a visual example of a deep partial thickness burn. This is an image illustrating the tangential shaving of a deep dermal burn, where dead tissue is removed until healthy bleeding is observed. Here we see an example of hypertrophic scarring that resulted from a deep dermal burn. Third degree or full thickness burns destroy the epidermis, all of the dermis, and skin appendages. They are characterized by hard, leathery, and potentially charred skin with visible coagulated vessels. These burns do not blanch and lack capillary return. Sensation is completely lost, even when probed with a needle. They do not heal easily and cause severe scarring and contracture. Third-degree burns are typically caused by fire, electricity, or prolonged exposure to hot liquids or objects. This slide presents a visual example of a third-degree burn. Fourth-degree burns are the most severe, involving damage to subcutaneous tissues, tendons, and bones. This slide provides an illustration of this depth of injury. Burn size must be formally assessed after cleaning the area. Care must be taken to prevent hypothermia during this initial exposure and cleaning stage. For small burns or patches, the palm method is used. The patient's entire hand, including digits and palm, is estimated to represent 1% of the total body surface area, or TBSA. For larger burns, the rule of 9s is used as a rough guide, especially outside the hospital. It assigns 9% to the head, each upper limb, and each side of the torso, 18% to each lower limb, and 1% to the genital area.